Psychological aspects of cancer. So we know that the diagnosis of cancer is not just a silly thing. So when we are breaking the sad news to the patient, how the patient as well as the family will take this news, that will be very difficult. That will be a very difficult situation. So the diagnosis of cancer not only just affects an individual but also their family members also. So cancer patients are psychologically and mentally disturbed and have many other associated problems. Therefore, the nurse performs the following responsibilities while dealing with the client. We have so many responsibilities to deal with so that we can ease the patient's situation. So aims and objectives of psychological care. So first thing we can do is providing positive approach for clients. So we can show the presence by verbal expression or a positive attitude as well as complete support to the patient. Otherwise, we can start a stories of surviving cancer patients. So we can discuss these things with the patient when the situation allows. So the response may be depend on. Okay, the response from the patients depend upon their disease type, their disability, their disfigurement. Okay, so all those things should be keep in mind while dealing with the patients. So that is the first one, providing positive approach for clients. Second, we have to provide support for the family. So we have to view the family as a unit of care. So we have to always be with the family so that the patient as well as the family can understand us. The family resources, the perception of cancer functioning patterns, the coping strategies and stresses are the factors affecting their abilities to respond to the crisis of diagnosis. So depends upon patients, the response also will be differ. For example, some persons will be able to understand what he is going to. For example, a chronic smoker who already got several counseling regarding lung cancer as well as laryngeal cancer might go through the situation in an understanding way. Meanwhile, suddenly a hard worker man immediately, coincidentally finding out he is having the cancer, will not be accepting the situation as same as the smoker did. So with proper assistance, the distress can be lessened. Third one is promoting positive self-concept. So cancer can affect physical, psychological, intellectual levels of the client. So sometimes a bread earner will become dependent on others. So as a nurse, we have to be there with them to promote positive self-concept by proper communications, success stories again, and maintenance of health. And finally, promoting coping. So due to stress and medication, the body image also can be changed. Weight loss, hair, loss of skin, change, hair loss. Okay, hair loss, skin changes, etc. So many changes will occur even after the treatment of surgeries. Disfigurement can occur. Certain procedures such as laryngectomy, glossectomy, mastectomy may lead to humiliation as well as frustration. So coping is very important. So proper explanation before the surgery is even before any of the treatment, even after the diagnosis of the case. To increase the coping, we have to explain each and everything to the patient properly, and at each phase the client's problem have to be addressed and taken care of. So you can add the points, important points, if you would like to add. Okay, so diagnosis and treatment. Here diagnosis and treatment is like very horrible situation because 70% of clients consider diagnosis and treatment as the most stressful experience. They are fearful to death. They may feel angry as well as frustrated. They may also feel isolated, fear about being abandoned from family as well as friend. They may feel guilty that cancer caused by their habit of drinking, smoking, as well as sexually transmitted disease. So interventions also will be accepted differently based on different types of patients. There are some clients who are good problem solvers as well as who cope poorly. So clients who are good problem solvers use effective coping method. They will avoid denial, they will remain flexible, accept support, and stay hopeful. So in some persons they are not able to cope properly, so they will be using avoidance, excessive denial. So we have to identify the clients who are not coping properly, so then only we can apply proper intervention. So stress, otherwise if the patient is already able to cope by himself the situation, and again we are interfering with their coping ability, that will be very disturbing factor for them. Meanwhile, if you are finding the persons who are not able to cope poorly, in those persons we can approach more and inform about, or we can do our interventions. So stress reduction as well as relaxation techniques can be taught to overcome anxiety in those patients. Speaking to cancer survivors encourage many of the clients. Again, the point is coming. So general coping strategies used by the clients. So sometimes the clients will seek more information about the disease condition or the treatment. Sometimes they talk with others to share their concern, and they will try to forget as well as will laugh it away. They will try to do things to divert mind. Sometimes they will accept it and live forward, go forward. Sometimes use excessive use of tea and drinks as well as drugs. Sometimes they will become isolated and blame others. So to facilitate the development of effective coping and to support, the nurse should do the following. So these are the interventions we can do to the patients in order to be with the patients. So be available and continue to be available, especially during difficult times. We have to exhibit a caring attitude always. Sometimes we also will be in stress. That doesn't matter. While we be with those kind of patients, we have to forget about our stresses. That is our duty. So listen actively to fears as well as concern. So help provide relief from try to provide relief from distressing symptoms. So provide essential information regarding cancer as well as cancer care, that is very accurate, and establish realistic expectations. So maintain a good relationship, like trustful relationship, and uh, always be open as well as honest and caring in the approach. And finally, we have to use touch to exhibit caring. A squeeze of hand or a hug may at times be more effective than words. Assist the patient in setting realistic, reachable short-term and long-term goals. Small goals we can assist the patient to have. Assist the patient in maintaining usual lifestyle patterns. Maintain hope, which is the key to effective cancer care. Hope provides control over what is occurring and is the basis of positive attitude toward cancer and cancer care. So many patients with cancer benefit from a variety of psychosocial interventions such as supportive listening, stress management techniques, individual or group counseling, as well as cognitive behavioral therapy. So we can refer the patient to the psychologist in order to get more support, as well as we can refer the patient to the counselors. So that is all about psychological aspects of cancer patients. So you can add your own points if you want. So by this we have completed one chapter. Thank you so much.